Good morning. This is Chairman Berlin. Let's bring this Finance Economic Development meeting to order. Roll call, please. Trish?
I'll do it. Okay, Supervisor Berlin,
Here.
Supervisor Negro, Supervisor Ellison,
Here.
Supervisor Kinney,
Here.
Supervisor Stendor.
Here.
We have a quorum present. Thank you. Item next is the approval of the agenda.
I'll make a second,
The amended agenda.
the
Yes.
amended, and I'll,
We have a motion to approve the amended agenda, seconded by Blake. All those in favor say aye.
aye.
Opposed? Same sign. Motion carried. Thank you. Item number next is public comment. Do we have any public comment? Any public comment online? Last call, public comment. Thank you. Let's go right into item number 4, approval of the minutes of the August 30th. Anyone?
This is Pat. I'll make a motion to approve.
Ron Stender will second.
Motion by Pat, second by Ron to approve the minutes as presented. All those in favor say aye.
Aye.
Opposed, same sign. Motion carried. Thank you. And financial consultants, you're up.
Okay, this is Mike Konechny. Hello, everybody. I believe Dan's going to share the budget status report. And this is as of the end of August. Basically 2/3 of the year over. Actually, in reviewing this, I don't see anything unusual or significantly one way or another here. As far as the revenues go, they can lag, obviously, because there's receivables and state aid claims and different things. So they're obviously they're under that 66.67%, but that is not unusual for human services and the general fund to lag the collection of some of that stuff. Moving on down to the expense side of this report. Keep going a little further. There's the expenses. If you look at the general fund and the human services, you're basically very close to the 67%, general fund 68%, human services 64.8%. So we're tracking pretty well along budget. There can be some payables that aren't booked too that would move that number up a little bit. County Road and Bridge Fund, the highway fund there, the third number, you can see that's at 41%, so that's moving closer to budget. Because all the work, summer work and some of the construction work, I think is being billed. So there's really nothing unusual there. That debt service, it's the same percent basically it was over in the past, but that's offset somewhat by the capital, and that isn't really a glaring issue. It's just the way some of the things were budgeted that we're changing for next year. So,
But can I just ask one question on?
yeah,
debt
sure.
service?
Any questions you want? Yeah.
Yeah, so debt service right now, we're total budget of 2,000,001. We've already year-to-dated 2.4 million, so we're over 117%. Do we rebudget if we know we're gonna be significantly over on debt service?
Well, I mean, you can obviously make a budget amendments. And I don't believe the county has historically done that. I know there are a few ones we suggested last year. That's something we can look at, right? A lot of counties do make adjustments to their budget when things are like that. And like I say, this wouldn't be anything you'd be spending out of fund balance. There's other revenues to cover that. So that's a good point. We can look at presenting a budget amendment next month. Any other questions or comments? I'd say overall, you're tracking probably where you want to be.
This is Pat, on the topic of the budget amendments. If I'm not mistaken, there's a policy that allows you to go over what's in a budget up to a certain amount, just so you can take care of things without having to come back to committees and the board for approval. So either we have a policy or we should develop a policy so that unless it rises to a certain amount, you're not having to come back and modify that. Partly just it's time and delay, et cetera. But it's also not clear from looking at this level of detail if there's one area of the budget that's contributing mostly to this, or if it's cumulative across other areas, none of which perhaps would rise to that level if it were fairly evenly distributed. So I'd like to see a policy as we consider this too, and if we have one to
I
review it.
do have one that I developed for another county a few years ago that I think would fit what you're looking at. I'll get that to Dan for your review.
Yeah, I had just one other question on ARPA. So we budgeted 1.1. We've not spent any really of that. Do we have that? Are we gonna get to spend that this year?
No, we're not. That was for the building repairs and we didn't get any bids. So in the upcoming budget, we're gonna it's in the budget again to try bidding again. We have an RFP out and those bids are due by October 30th.
So like, as part of the adjustment to the budget, if we know we're not gonna spend 1.1 million, then we would likely wanna just fix that, right?
Dan, if I can respond to that
Yeah.
a little bit. See, the way that ARPA money works, you have the money on deposit. You know, it's in your bank accounts. And the way the federal government requires that, it's not recognized as revenue until you spend it. So it's sitting there, and you can see, I think we budgeted $1.1 million in revenues and in expenditures. So, I mean, you could amend that, but it's just, you know, if it's not spent, it's not spent. So it's going to be unrealized revenue and unexpended expenditures, and not necessary to have a budget amendment because you aren't moving it anywhere else.
So we're not just putting $1.1 million into our budget that can go towards anything, right? Because it has to be earmarked for specific
You,
projects.
right.
Yeah,
You,
you have to allocate it for specific.
you have to approve that. You have to approve those projects and then, you know, obviously state you're using ARPA money. So it just sits there as unspent and unrealized revenue. So it's really not necessary to amend your budget there.
Thank you for clarifying.
Anything else? Okay,
Do we need a motion to approve his report? No,
It's information.
thank you, Mike.
you're welcome.
Moving on to budget, 24 budget. Are you gonna grab that too, Mike?
Yes, and Dan has that on his
Yep, I'm
screen
just getting
also. Okay, this is an update of the report that you've seen, you know, last month. And we have at the bottom, I mean, at the bottom, we're gonna keep every monthly report here. The bottom line is, you know, we've had a lot of discussion with departments, with human services and other departments on changes to the budget. And the most significant ones were made in human services. We reduced their levy fairly significantly. I believe it was like 900 and some thousand prior, so it's their increase in their levy is projected at 574 right now. There's, and if you want to scroll to the bottom, Dan. Okay, right now, your levy, column D is your levy there, 9.5 million is what's in the on this report right now. You take out the library levy because it's in there, but it's not subject to levy limits. So your county levy without library about 9.4 million. The allowable levy limit is 9.151. So right now you're 279,000 over your levy limit. Just a couple of comments about that is there are some further discussions with some departments on reducing their levy. I think Sheriff Department is one of them. And also just yesterday, received a state aid transportation estimate. And if you may recall, or maybe you don't, but we made some amendments to the reported expenditures last year for highway for earlier years that actually increased this amount. So that amount is about 60-some thousand more than your budget right now. So we'll look at how that fits in, but that potentially will reduce this 279.
Right, and also, we haven't had a chance to go through Sheriff's Department budget because of staff vacations in the Sheriff's Department. So I anticipate a few savings there. There's money in contingency, there's 200,000 that's unallocated right now. There's money for LaPointe, depending on what the county board decides to do, or this committee. There's money for a space needs study, depending on what the committee decides to do. So the sales tax revenues, which is in the updated projections in the packet, I can bring that up, is way ahead of what we've been budgeting. And I did speak to Dale Knapp of Forward Analytics at WCA, and he's pretty confident in those numbers. So there's also extra legal fees and administration that we can move depending on what we do with LaPointe again. So this $279,000 we can easily get down to zero, basically.
Pat, go ahead.
Blake had a question about earlier about we're going over budget, the debt levy. If we need to take money from somewhere, is that money coming from contingency? If you were to develop a policy for budget amendments?
Well, it could come from contingency. It could come from just the general fund balance. It could, however, the finance committee and the county board decided to do it. There's a number of places.
So that leads me to this question. Why do we have a separation of contingency versus general fund? What's the purpose of that? And how might that tie into a policy if we're over budget and money needs to be pulled from somewhere?
All right, so the way it was set up contingency is these are monies that we may or may not want to spend on different things. So we budget for them, and then later on in the year, if we keep the money in contingency, if we have unexpected expenses, then we have a place to draw the money from without affecting our general fund balance. If we know we're not going to do a project that we put into contingency, we can slide that over and as revenues and as lower this 279 number. But the contingency is just there for emergencies or for projects we're not sure if you want to fund.
But what purpose does it serve other than, does it serve a purpose? Why not just have it come from the general fund? Is there a reason for that segregation, for maybe how we, are bonded or going through a process to approve funding things?
Again, right now it's sitting out there as a holding account for specific projects. So, like last year we budgeted a bunch of money in contingency, and that was to do staff raises on July 1st. So we set that money aside in case, because we didn't know November they're 100% sure that we're going to go approve the wage study and implement it. So we set the money aside in the budget so we could do it if, assuming the county board agreed to, and which they did, and exec agreed to. And so we had the money in place to implement it. If the exec committee had not approved implementation at the time, then that money would have been sitting there in the general fund and we would have been able to use it on whatever else we wanted to.
So it seems to make sense to have a contingency fund because there's, all things being equal, probably history showing that there's some things that you may not yet know you're going to incur for
Right.
expenses, but over time you can expect that you're going to incur some of those. So we could look at past history a little bit on how much was used for contingency. So when you look at this, getting down that 279,
Yep.
it seems taking from contingency is not somewhere that we should look because it's there for a reason. And we have history showing that we do use contingency funds often enough that we should leave money there.
Right. Well, I could say there's 200,000 right now is unallocated for. So there are other projects where there's money allocated for in there. And it's gonna be up to this committee and the county board if they want to fund those projects or not. We may decide we don't want to get down to drop that 279 number. But a lot of it depends on decisions you're gonna make soon on how we get that 279 to zero. I mean, there's money we can cut here and there to get us down. Raise sales tax and there's things we can do. But I've been trying to keep the sales tax number low at 2022 levels, I think it is. Because that way we have a cushion. We expect it to be 150, 170,000 higher. But if we budget less, then we have that 150,000 as a cushion later on, which is essentially contingency money.
Yeah, so Health and Human Services here. So 2,081,000 was adopted tax levy for 2023. We're requesting 2.655 million, which is an increase of 574, which is Health Human Services. Totally understand the increase, but that's like a 20+% increase for their budget now. I'm assuming that you guys have given Dan and others this budget, so there's some transparency, but as the finance committee, it would be helpful. And again, I did look through it a little bit and it makes sense, but that did stick out to me as a significant increase. And maybe if Dan wanted to just say if he feels like that is going to be the number.
Well, I can say, and Amber, step in if I'm wrong here. I can say that the biggest part of the increase is wages. We're doing this. Well, we're making the assumption the county board's going to approve a step increase of 2.5%. So that's by far the biggest portion of the increase right there. The other portion, gigantic portion, is the healthcare commitments. And I want to stress court-ordered healthcare commitments, not, and that would be to put children and or adults in facilities that the judge orders them to. Some of those facilities can cost us ungodly amounts of money. To send a kid to Lincoln Hills is over $500,000 a year. It's something like $3,100 a day or $3,200 a day, if I remember correct. In fact, I might even have the letter on the drive here. I asked Terry to send it to me. Don't remember if I put it on here. But here it is. Here's a good example. So the daily rates. So for a juvenile correctional facility, this is your daily rate. Now, we don't have a choice on that. A judge would order that, and that's what happens. And we pay for it. The same goes if an adult is committed to, say, Mendota or Winnebago or some other place. The costs are similar, maybe a little less, but they're close. And we don't have a choice for that. We have to pay for it. So that's where the two big drivers of the increases in their budget.
Do you want me to touch on some of the other, I just had like a list of a few things and like he's talking about the placements. We added 350,000 to our budget this year for under the children's placement. And the main reason for that is just looking at our history, and unfortunately our trend is going up. So in 2021, our costs were 946,000. In 2022, it was 1,245,000. And looking at this year, the projected, what we have through August, and I just took an average, if we were to continue through the rest of the year, we're looking at 1.1 million for this year. So we budgeted a total of $1 million for just children placements. And we hope that that's high, and then this would maybe take a drastic change next year and go the other way. But just with our history, we definitely wanted to have that much increase so that we have a realistic budget. So that's a big chunk of our increase. And then the other is wages. There was a big increase with wages. We did take out, with the suggestion from the consultants in our meeting, if you're not hiring right away and stuff, they asked about putting in a buffer. So we did take 4% of our wages and fringes, which adds up to be quite a bit. So that was another reason we were able to decrease it from our last request to now. I'm not 100% comfortable because we are talking cushions, and I like having cushions, and I feel like we don't have any cushions. But it'll be what it is. The other thing that we increased, we did add 75,000 to our budget for transports. Thank you. And the other side of that is actually on the sheriff's department. We're just paying the sheriff's department for it. And then our hopes is to maybe try to get some reimbursements if there's anybody that has MA. So the hope would be, but that is additional. We did increase our cost. We did lower some of our revenue because we don't have some of our COVID money. So overall, if I were to add up all of that money, like it would be really realistic for me to say, to stay at that, we need to increase it by over $1 million. But we feel pretty comfortable where we're at. And I say comfortable that I think that this would be a good budget. I feel like we're very, very trimmed, and we couldn't find anywhere else to trim.
So there is one other avenue for funding those commitments, court-ordered commitments, I want to clarify. The state statutes do allow us to take out debt to cover those costs. So if we go over down the road, that's an option we have, is to take out debt. Or we could do it now if you wanted to, but that money would then have to be dedicated towards that purpose. Right now, that's not in the budget to do that, but that's an option for this committee going forward.
Thank you for coming and explaining that. So just now, is it all Ashland County residents, including tribal members, or did they have separate tribal members would pay, the Bad River would pay for that, or do we pay for that?
Ashland County pays for all tribal members, whether they're children or adults, for court-ordered placements.
And then we request reimbursement, obviously, from
No,
them.
we are required to pay those.
Okay. All right.
So moving on, the highway budget's in the packet. Mike and Steve worked with them extensively. The one change we're looking at, and Matt is busy getting the numbers right now, is if you look at I'm sorry, I'm gonna blow this up because I can't see it. So right here where it says supervisor truck and HHS car, I asked Matt to look into that because one, you can't buy a truck for 40 grand and the government discounts are gone. The same thing with a car. I mean, the government discounts are gone and you can't buy a car for 30 grand. So I had Matt look into leasing them and adding them to the lease we have at the sheriff's department. So that will have the potential impact of lowering our debt levy quite a bit. So hopefully we'll have some answers on that pretty quickly. Other than that, the highway committee's approved pretty much everything on here, and the state transportation aids, right here, where I'm moving the cursor. That's what Mike was talking about earlier today with the GTA revenue. They had budgeted 533, 660. It's gonna be 599 something, close to 600,000. So basically, there's another $66,000 in revenue that we can take out of the levy request for the highway and add it to that 270,000 deficit.
Going back to those vehicles, if we do lease them, if I recall, those payments can go on the debt levy.
Yes,
So we would have a lower debt levy this year due to vehicles, but we would then be pushing that out with that added debt levy due to lease payments in future years.
we would, except there's a vehicle request every year. So we would check the need. First of all, do we need to buy a new truck next year? And if so, can we lease it? Because every year we're buying new vehicles. So it's still cheaper in the long run to lease it. Especially when a new truck is 70 to 80 grand.
So for Mike and Stephen, those state highway aids, how much of that increase is due to better record keeping, accounting, that sort of thing that you talked about a few meetings back?
It's 100% Mike and Steve, that increase.
Yeah, and I think we should note that they've been phenomenal since they came on board with us, and just one thing like that we otherwise would miss more than pays for having them on board.
It
Yeah.
does, and not only does it this year, it pays in every single future year.
Yeah, so thank you for that. We appreciate it.
You're
So
welcome.
that's a huge thing. So yeah,
Yeah.
so that 270 number you saw earlier can be lowered now. Let me put that number up. Lower by $66,000. So we're now down to 200,000. Basically, 210. And like I said, there's minor cuts that we can make elsewhere that add up to 10, 15 grand. Then depending on what we do with the point, there's money there that we can move over. Depending on whether this committee or the county board agrees to a space needs study, there's 50 grand we can move over. So like I said, that number is pretty easy to get down to zero. Just a few decisions have to be made on what we want to do and don't want to do. But in either case, we can do them all and still make it work. So I am going to say, kind of off topic here, but on topic, that we're looking at, we have to go to press on the 20th of October with this budget. So state statutes say you have to be published 15 days before you're going to vote on it and have the public hearing. And that's going to be November 7th. So 15 days before would be October 23rd or 23rd, but of course the newspaper doesn't come out on the 23rd. So it has to be in the October 20th edition. So we're planning on holding a finance committee meeting right before then. It won't be the 18th. I'm going to be in Madison. But
Just a question on the process. Doesn't it count if it's online too?
I'm sorry.
So if we put it in and doesn't the time start also if we can put paper in the places we're supposed to put paper up, but doesn't it count also published if it is online also?
No, not for the budget.
Okay,
For other notices, it does
Okay.
count. But for the budget, it actually has to be put in the paper.
all right.
Yeah. And there are state statutes on how much they can charge us for that too. Yeah, but anyhow, I just want to let you know where we are in the process here, because this is going to be part of the discussion. We'll do that at the end of the meeting, but yes, I am going to ask to move it because I'm going to be in Madison. So I am going to ask to move it to the 17th, but.
So your last statement, you're looking at moving it to the 17th?
Yeah. We're doing it later, but I just sort of want to let you know, you're gonna get another crack. Sorry, I just want to let you know you're get another crack at looking at this before we publish. That's all. So I don't know, are there any questions? Like I said, I assume there's gonna be savings in the sheriff department too. So. And Nate will be back off vacation next week.
It would be nice to have one document where we show all these little pieces instead of as we're scrolling back and forth, go, there might be this much here and this much here. Let's just put it on one piece of document or paper and just say, here's where we came up with 20,000 from this or 60,000 from this, and just put it on the line so we can see where the shifts were.
Yep.
Because you know, if somebody looks at this stuff online, there's a lot of this stuff that people aren't going to be able to understand, and I'd rather have it clear for people.
Yeah, we can make a notation of where we changed things from this document.
Yeah.
And there is a date on this document, so you know what date it was from. So yeah, I think what we can do is at the bottom, we can note all the changes. Any questions? Pat, you're looking at me. Okay.
Well, and I think I'd like to point out, I know that Pat said thank you to the guys, Mike and Steve, about getting this in one great looking format and such. But I think it is important to mention, bless you, that previous to the last administrator, there was some weird shifting that was doing in the budget, and I don't think that the county board had a clear picture of what the budget was ever. So having this clearer picture and knowing where these dollars are going, I think we have, I think it stepped us up. We almost look like we're doing something. But it's great to see all these numbers, and I know I'm the biggest pain in the butt with this, and I'm gonna keep being that way. So, you know, I don't think anybody's surprised, but I love this detail. I love how it gets more clear so people can understand it too. And being able to lay out that next path so we show people what we've done and where we're going is still another prod I'm gonna do in there for the next 3 to 5 years, as you mentioned last meeting.
Okay, so there's one aspect of the budget we didn't cover. And that's health insurance. So we had budgeted 10% increase in health insurance. I talked to M3 this week, and unfortunately they couldn't be here because they had COVID. So we're looking at a 9.9% increase. So good news is we budgeted the right number. The bad news is it's going to be the higher number. So in that respect, I think we're good. Otherwise, I would have said if we were coming in at 9%, well, we can go through the budget and get that $279,000 pretty much quickly just by adjusting that number. And we may still have to go adjust it to 9.9 and we'll still get $50,000 to $100,000 in savings. So there's that. So that portion's good. And then also M3 will be here at the next meeting to finalize that.
All right, thank you, Mike.
Okay, thank you. You're welcome.
Let's move on to a health savings account discussion.
Okay, I know there's been a lot of talk in this committee, and looking at the majority of you favor moving to this. And I'm glad Terry's here because we did have a meeting of our wellness team about this issue. And Amber's a member and Terry takes part in it a lot. It is the general consensus that we do not think we should move to HSAs this year. And I'm going to let them step in a minute here, is the big reason is it's going to require huge increases in deductibles. And we don't believe staff is ready for such change, especially after the last couple of years. They know increases are coming for sure. I mean, because everybody knows about inflation. But we don't think that they're ready to make such an adjustment, and we would like the rest of the next year to sort of explain to them what an HSA is and get buy-in. And Terry and Amber can tell you what they've heard in their department.
So I do
Before
believe
he,
there's a
before
lot
he
of,
dumps this on you, just hold on a second. Cause I know he was really good at shifting that. He's like, but they're here, so. I'm
Well,
just
they
kidding.
actually want to speak up.
I'm
too.
just kidding. I really would have liked to have M3 here because I'd like to have a discussion about how we can soften that for people. Because when we move to those higher deductible ones, it saves us with costs, but we can also take some of that savings and give those back as a way to ease that step.
Right, the employer contribution to the
Yes.
HSA.
and we did have discussion with M3 on that. And I do think there's huge support for this. It's just that the wellness committee has been involved, but the rest of the employees really have not been informed. Some of them don't know what an HSA is. One of the concerns that was raised was obviously what you just said, the higher deductibles and having the county kind of help by a contribution. The fear is people who have had those changes to the higher deductibles have had, and this is locally, a couple people have been affected by this. And like the first year they contribute and the next year they contribute some, not as much, and then they didn't contribute. So that's kind of a fear that we think the county employees would want some kind of assurance that it's not just going to be a one and done and then we're stuck with these high deductibles. But I think the biggest thing, and Amber can speak to it too, is just most of the employees really aren't aware of this and what it is and really the benefits of it. So just kind of doing more information for them.
Kind of like, oh, go ahead.
Well, for the sake of brevity, my understanding was this would become an option, not a requirement that they had to shift. Because my work experience in other places that have offered an HSA, I believe it was always an option. Numbers that enrolled were extremely small to start with. And then over time, as people understood it better, more people switched. And from what I've read, a lot of places after a while, it's okay, everybody or almost everybody's on the HSA after 5 years, 10 years. And then that becomes the only option because, well, almost everybody picked it anyway. I have no interest in mandating going to an HSA as the only option, but just introducing it as an option to transition from where we're at. And then seeing what the employees decide over a period of time. But I would expect it would be at least 3 to 5 years before significant numbers pick the HSA option. So just a transition, but not a abrupt switch. I don't support an abrupt switch.
Just to second that, our understanding, I believe, was that this would be, the options would be the same today, but this would be an add-on. And then it sounds like exactly the issue that we talked about is that it's all education, right? It's not that this is worse, this is better. It's they have a choice for education. And the HSA, if you educate and the people start it, they oftentimes become, oh, and by the way, the county is not going to pull our support because it incentivizes the employees to go there. And then it saves us money long-term because they're more thoughtful about their approach towards healthcare. So it's really educational and I think optional, but like we did not want you to feel mandated at all. So if that was the implications, that was not actually what we were looking for.
Yeah, and there was a lot of discussion, and I didn't take it that it would be mandated, but part of what M3 said is we can't have, I don't think, now maybe I'm remembering this wrong, I don't know if we could have both the flex and the HSA.
We can't have
Flex.
both the flex and the HSA.
And those
No.
are the options we have now is like, we either do the flex plan or the HSA. And the other side of this is timing. Like I am 100% for an HSA. I've had HSA, I have flex. I would like to go back to this, because if you can save the money, like 100%. People that are retiring can bring it with them. Like everybody is in agreement that this is something that they want to do. But the other thing is like our staff, everybody's workload is very high. So to try to add this to, clerk's office fiscal staff for us to try to get this implemented in time by January 1 and everybody educated, we just didn't see that, it was possible. We felt like it would be better to come up with a better plan. Wellness committee can plan for it. Things, more incentives we could do that can add into the HSA account. I have discussions with you guys, so you guys can come up with a plan, an extended plan, not just a 1-year savings plan. So that was really the main force, was like time and education. So like, we do want to do it because I think when it added 1,200 per deductible for a single and 2,400 for families. So, and that's just one of the options they gave. It's not saying, and that can be quite a bit of money to shocker to somebody, but it did save in the premium. So that'd be all stuff for you guys to look at.
Yeah, that's why I wanted them to lay out different options for us when they came and presented. So I would have hoped that we would have had those options before you guys had to look at this, so that way you had good information, but also, yeah, putting this as an option and then us figuring out dedicating, because controlling this, I mean, besides the big three, you know, HHS and Sheriff's Department and highways, this healthcare plan has been a three-headed beast for us because it's been just kind of wavering on its own, hoping we're landing in the right spot with our expenses. So now that we're getting control of it, we can make it a little more predictable. I know there's accidents and things and health problems, but we can still lay it out and have a good plan for it. And then also have a good plan going forward as how we support you guys with this. I mean, it's supposed to be, you know, health insurance is supposed to be a bonus, you know, fringe, fun little balloons things, not something heavy and anxiety causing. And that's why I wanted to have that laid out. So I would have, when she talked to you guys, I wish she would have had that stuff already.
So question for Dan, I understand employees have to pick one or the other if there's option, but you said, when you say we can only offer one, are you talking about a legal reason why the county can offer only one healthcare plan, or is this because of our insurance company?
We're not legally allowed to offer the flex spending plan and the HSA. You can only offer one of those. And so, you know, what's going to end up happening is employees are going to have to be forced to choose what you choose. I
So is that
mean,
a restriction on counties but not cities or other?
no, it's all in all employers.
It's an insurance law kind of thing, because of the two different accounts that Flex is, you know, you have to use it by the end of the year.
Right.
HSA is kind of, you can build
Well,
that sucker
yeah.
up. So
It's a tax thing. It's an
Oh.
IRS thing.
There's regular insurance and there's the FSA option today. What we're saying is that we'd like to have the regular option and the HSA instead of the FSA.
That's where the employees are going to have real problems, because they'll view, and maybe I'm wrong here, but if you force the HSA on them, you're going to view it as they're losing the flex spending plan, which a lot of them like.
When did that come into effect?
That federal law, I don't know, it's federal law, maybe with the Affordable Care Act,
When?
maybe with the Affordable Care Act. I'm not sure.
I think it was before that too. That's why when we had originally discussed all this, that's why I wanted a HSA option. Because, you know, we kind of pigeonholed people with the FSA stuff. You only had one or the other. Do we know what the numbers are, the people that actually picked that option?
Offhand.
Okay. That would be good to know too, because, and so I even forgot about that because I wanted that HSA option and we were kind of overruled because of cost. It was more exec than us. And we did a lot of research for this committee to do that stuff. But we kind of pigeonholed people. So I don't view that FSA option that it was the best way to start out, but here we are and yeah, having that plan to implement. And like I said, then all the different options laid out from M3 is we got to figure out how to fix this again.
So Dan, do you want a motion on direction to go forward with this? Because last time we did, I think, at least me, I misunderstood that we could have this as an option along with the other. Maybe that's just me misunderstanding what we were allowed to do. But do you want direction on healthcare plans this year?
Yeah, that would be good.
Mark, here's what the executive.
I mean,
committee
exec
did
committee already
yesterday.
did it, but it would be good if finance did it too.
didn't we already, but we haven't even had the presentation from M3 on what all the options are. How do we direct anybody when we haven't seen the full education
Well,
piece on that?
Well, you're right, and that whole education piece is gonna take a long time to put together.
Well, as a committee, we kind of need to have it first.
Right.
Because we can already see there's already issues that are being created, but we kind of need to see the options before we make a good, I mean, what recommendation are we gonna make based on some ethereal stuff? That's why this would have been the meeting to have M3 at, to let us know what these options are, and then to have them also bring up what would be a good transition, because they've done this before, they're a consultant, it's kind of paid for, so.
Well, just in terms of where we're at with the budget process, we're late September, we're gonna have a meeting third week of October roughly. Are we gonna have another meeting between now and possibly October 17th?
We,
If the
Don't have
plan
a-
is no, then
we
just,
don't have one on the calendar.
I mean, otherwise, just given where we're at, if, so that the budget can be finished and insurance company can do their work.
I think after hearing from the employees and based on the conversations, I don't think we can, move forward with this HSA right now with
I
them.
think there really needs to be more information.
Yes.
Okay,
I
then
think
when we
employees
talked
need to
about
know.
this, we talked about this at the county board meeting, why wasn't this, when she came and presented the stuff and we peppered with all the questions, why wasn't this information ready for this meeting then? Because this is kind of us making the decision. So she should have been here, or somebody should have been here
Well,
for this meeting to get us the right information.
Well, she had COVID, so
Huh?
she has COVID. That's why she can't be here.
There's gotta be somebody else. She's got a backup. But here we are again, dragging along another year. Cause first, we didn't get the information for the wellness committee to the people that needed it first, and that took extra. And now we had already discussed this stuff about getting the information about all the different options, and we don't have it for the meeting that we needed at. So we need to plan better with this stuff, and it just, I get it. She's got a health issue, but there's gotta be somebody else that could have come and given us the options, so we could be able to move on this, or at least lay out a plan. Because if we don't have the options, here's where more people normally do this, blah, 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 then we're behind the eight ball.
The
The eight ball
question
again.
is, what are we, what's the recommendation on the table at this point in time? Do we want to push this a year? Because this is the direction the executive committee went with yesterday.
That's what we were thinking was mainly so that way we could get that, like exactly what you're talking about, have that meeting and like get that education, and then you guys can make your plan and we can make a plan of putting more, like, more incentives out there than just getting your physical. You know what I mean? We have big plans on that stuff. So that way, like, if you guys say, we're gonna contribute, we have to see the numbers, I know, this much money in the next whatever years, we can say, you can put more money in there if you do these preventative things. So I think it's gonna be a little bit of collaboration. I'd rather have like a really good plan, and so that it's like, when we get to this point next year in September, the plan is already all in place, and then it'd be a lot easier to implement. And
So for a process to finish the budget, given where we're at, am I correct that we don't need to take any action for the county to continue with the current healthcare plan that they have, as executive committee indicated that they?
No, you don't
plan
need
do?
to.
I'm correct on that?
Yeah, no, you don't need to.
And then, to add to what Laura said, I think there's some frustration on finance, in particular probably for Laura and I, because several summers ago, we spent a lot of time, and I mean a lot of time, on all things healthcare. Her and I were on a healthcare subcommittee, and to say we spent a lot of time reading a lot of stuff is an understatement. It really is. Where I think we both would have rather been doing other things, but we were very dedicated on that healthcare subcommittee. And in the end, right at the end, and practically unbeknownst to us, the executive committee said, oh, we're just going to leave things. And I think Laura and I, that's where her frustration comes from. And it is more than understandable. If you think she vented, she held back from what the time we spent a couple
I
summers ago.
led a meeting interviewing 3 different healthcare companies, standing in a bathroom in Great Falls, Montana, because I couldn't find a business room because it was during COVID. I stood for 4 hours doing that. And and I don't knock that, but the preparation that we've had for this isn't a surprise. This is not a surprise. We talked about the HSA option up front. We've asked for these numbers. I've asked for the numbers more than once. I've asked for a good plan. So yep, I'm a little bit zingy right now.
So to the administrator, you weren't here when Laura and I spent time on this a few years ago. But if the executive committee is the committee that decides this, then hopefully you let the executive committee know quite clearly that the finance committee has expressed a strong interest in the HSA going forward, and that you work with the executive committee and the wellness team so that this education starts occurring sooner than later, because near as I can tell, the executive committee hasn't been proactive at all on considering doing their part to help move forward the educational part of this, working with the administration and the wellness team. Otherwise, we're right back in the same place next year. So if we're not the committee that has the say on this, then the committee that does have the say, I would hope would be more active on supporting that education piece. So a year from now, the employees can say, we've had a good look at both options. We think we understand both, and here's what our preference is. So we're not repeating this, because this feels like year 3.
Oh, at
Yeah.
least. And,
Yeah.
and I do want to, because I'm pretty certain you two were on the committee too. There was quite a good group, a really good group of staff members that all had input on this. I mean, we wrangled this stuff up one side and down the other. So it's not, like I said, I come into this spot and this is what public service is. But I need exec committee and anybody else that is making decisions without the information that all of us put in time on to actually understand what's going on, because this is just ridiculous. This is why things aren't getting done. And not everything needs to run through exec first. Maybe they need to come and listen too.
A big thank you. Big thank you. So we don't need action on this, Dan?
No,
We chewed this up and spit it out. Let's move on. Very good. Possible use of opioid settlement money.
all right, so, a proposal came out of HHS that we just want to run by you first. I don't want to I don't think we should make any decisions on opiates settlement money yet, but, start to keep it in mind, bearing in mind that other departments have other ideas too. And, PPLE will be discussing this as far as the sheriff's department is, but since, Terry's here, why don't you explain your proposal?
Ashland County Health and Human Services has put together an overdose fatality review team because unfortunately we are kept busy every other month reviewing the overdose fatalities that we've had. And we review everything from what we know from their childhood, whether they were involved with child protection through their adulthood, if they were involved in our mental health and AODA systems. We have paramedics who may have been involved with different calls that they've had. We have the law enforcement agencies who may have been involved. Everybody, the hospitals, the clinics, everybody who has had involvement with any of these folks who have passed away because of opioid fatalities. And we review those cases and then we come up with recommendations. And we've been doing that for a year. And the consistent recommendation from the overdose fatality review team is that we do not have a good system to transition folks from treatment back into the community. So what the recommendation is from Health and Human Services based on the opioid fatality review team is that we recommend using some of the funds, not all of them, but some of the funds to have an adult family home who would specialize in mental health and substance use and know how to support those people in recovery. It would be a 1 to 2 bed adult family home. So that's a home that is owned and operated by the homeowner and or their family. They would get a lot of information on how to support them. They would be certified to provide services under the Comprehensive Community Service Program, which is you've heard it called CCS before. That can fund some of the treatment in these homes. So we've carved that out so it wouldn't have to come, that those pieces would not have to come out of the opioid settlement funds. But what we really envision is these people need a wraparound when they return to the community so that they can learn some basic skills they may not have learned because their parents may not, it might be a generational thing. Their parents may have been users as well, maybe not the best equipped to really teach their children how to have coping skills and resiliency and, a good life without being addicted to substances. And that's been a recurrent theme. So that's what we're recommending. The basic cost for an adult family home is about $2,500 a month for one person. It is substantially less than what we pay for people who have to be in treatment long-term for months and months at a time. That's usually $10,000 a month for adults. And again, we can carve some of the care and treatment out if they're certified to provide services under CCS. So that would, allow us to really spread those funds out further. I am aware that law enforcement wants to use some of this funding for Medicaid assisted treatment in the jail, and I totally support that 100%. I think that's extremely important as well. One of the things that was brought to my attention was a new funding opportunity specific for treatment for people incarcerated with opioid use disorder for counties with a population of less than $70,000. I am aware we don't have a grant writer at the county yet. However, Health and Human Services is very familiar with writing grants. It's not our favorite thing to do, to say the least. But there is funding available for counties to apply for. A total of $1,878,000 is on the table. 443 is specific to counties to apply for who have populations less than 70,000. And our public health officer, Liz Zott, and myself would be willing to apply for this grant if this is something we would consider.
So would this be a private home where the people are already living there and they have the training certifications as necessary and they have the physical space?
Yes.
And then would the city, if it's in the city of Aspen, would you need any kind of conditional use permit or any other permission from them to
Not as
provide
long
those?
as it's 1 and 2 bed. They would be licensed through the state. So the Division of Quality Assurance does the licensing for them. And then once they're certified, then we can contract with them.
So if the city does not have any authority to say no to this, are you going to notify the city anyway, or and the related question then becomes, once the neighbors find out, oh, this is what's going on next door, you were able to provide a response that includes the legal authority for these people to operate and so that there's not pushback and we don't get started and then find out we've
Well,
have challenges.
I'm sure we could. This is not a new concept. We have many, many adult family homes already operating. This would just be changing. So most of the adult family homes that are operating in the city and the county of Ashland right now are managed by our managed care organization, which is Inclusa at this point. Inclusa cannot only have participants who only have mental health and or AODA. They also have to have a physical disability or a developmental disability. So there are many people who already have a mental health diagnosis, a substance abuse diagnosis, who have coexisting dual disorders with physical, they're actually being eligible because of physical disability or developmental disability. So they're already in our community. It's just family care cannot fund folks who only have mental health or substance abuse. So that we don't have a funding source for that. So this would be a funding source specific for these folks.
And then one more question. I assume there's evidence-based research to support the request for what you're asking for.
We would not be using an evidence-based practice, but this is an allowable, acceptable use under the settlement agreement, the allowable costs for this because they recognize that housing and treatment together are effective.
So it strikes me as something worth supporting, but I'm not an expert in that field. And so before we pass that budget, I would like some type of documentation and research that shows that if we provide this, all things being equal, we have better outcomes and lower costs as a society for having done this as opposed to not having done this. I assume that if it's in the opioid settlement, somebody or a group somewhere looked at this and they came to that conclusion, or it wouldn't be in there. Is that a fair statement or question?
I can't answer that.
Yeah, I know it's allowable,
Yeah.
but so now I'm making an assumption, which I'd rather not do. I'm assuming that this use leads to better outcomes, that my concern is we've got politicians involved and they think, oh, this sounds good, that sounds good, but then politicians don't always get it right. So I assume somewhere there's some evidence and research that shows these are worthwhile doing. Yeah.
So I just have one thing. Yes, right now what's happening is people are being sent back into homes that they came from and they're instantly going back into, and then they're dying of overdose, right? So that's what's happening. And so what they're trying to say is that's not working. We want to have this other option. And this other option is the best option that we have because we don't have a large facility to house. The one question I have is that there's this real focus on opioids, and opioids massively became an issue, but we have this huge alcoholism. We have this huge methamphetamine, other things, right? And so if I come out of a detox for alcoholism, I get sent right back to my home in the same setting and I instantly revert back. Or same thing with methamphetamines. I don't have that. And so one of the concerns I have, and I'm not saying opioid isn't a great thing to throw money at to try to help these people, but is this focus only on the opioids and not any other type of treatment?
Most of the folks who we have reviewed are multi-substance users. So if they can't have their opioids, heroin, they will switch to methamphetamine. Methamphetamine these days is most likely laced with fentanyl, which is an opioid. So even your cannabis that's out there, young kids are experiencing fentanyl laced cannabis, marijuana that is throwing them off. So this funding has to be specific to opioid use because it's the settlement funding. But I think it's going to capture more than just the opioid drug user because they're using many, many different substances, whatever's available.
And I brought this up in HHS committee too. I still would like to see some kind of regional planning with this opioid money to make sure that we have a good plan. Because I love this stuff, except it feels like a Band-Aid. Because we're trying to get what pieces that we might be able to fit in. And I know I've talked to the sheriff's department about Matt before, because I've been in pain about that too. But I think starting with something smaller like that, but making sure that we still have a regional planning thing. Let's bring in Red Cliff and Bad River and Bayfield and Iron and our county and as many as we can and get some kind of regional plan and regional treatment. And everybody's been looking at it, but again, we're doing it piecemeal and we only get so much of these opioid funds, and laying out a good plan and then trying to make sure that we're all funding it, because we know we can get a treatment facility probably, but then where's the funding going to come afterwards? Getting that buy-in from the state, and because I don't see this as going to go away if we're trying to jump one thing at a time.
And Bayfield County has reached out and asked us where we're at with that. They have an interest too, but one of the things I want to stress is we don't want an 8 or 16 bed facility because we have those available to us and people can access that through MA. It's the transition and we need it to be a smaller home-like setting. We think that's what's really going to be the effective piece.
So do we have a recommendation here? Where are we going with this? Are we going to make a,
Well, I
Action?
think Supervisor Negro wants a little bit more information. But this is something for you guys to start considering.
So would people that participate in this would that be voluntary or would that be something required?
Our goal is that it would be voluntary because people who voluntarily agree to go into this kind of a setting have much higher outcomes of success rather than being made to do it. However, it would be a step down for some of those folks who have been in court-ordered placement, which again, we don't have funding for, but we could step them down as a transition. And usually after somebody has had a period in treatment and they've been sober for a period of time, you know, when you look at where they're gonna go, some of them are homeless, some of them don't have good family supports. A lot of them know that if they go back to the home that they came from with the friends and community that are using around them, that they're gonna fail again because there's peer pressure to use and that's what they know. And if they're going into a home where there's people using, their success rate goes down.
So I got two questions related to that then. One is, does this potentially give the judge another option in terms of developing plans to work with people? And then the second, you mentioned homelessness, that was my other question, is what if a person really has nowhere to go because a lot of people don't?
Yes.
Is this then potentially a place where people might say, you know, I really got nowhere else to go. This is a better option than, say, the street.
I definitely see that as a better option. It would not be long-term. This would be a family who's going to be actively working with the person to try to find them employment and housing along with the recovery supports. So, you know, a multi-faction with the support of CCS. So they would be a CCS provider, but they would also be on CCS, which has medication management and therapy oversight and case management and, you know, just a whole robust support system.
Pat, this is something I talked to the CJCC, the Criminal Justice Committee. I talked with them a couple of years ago about trying to streamline, do some pre-trial changes with people, and we do have the drug court and such, but I think this does give another option or another path, you know, to do the best that we can for everyone that's involved. Sometimes we need to be gentle with those people that have the worst circumstances, and I do think this is a very good piece of that, and I think it gives the court more options.
So this is Pat. I'll make a motion to approve this request along with the one that the sheriff would like.
This is Blake. I'll second that.
We have a motion by Pat, a second by Blake to approve this request. All those in favor, signify.
Can we have just a second here? 'Cause
Discussion?
I'd like to get a piece of this discussed with PPLE too, and our committee doesn't meet yet, so.
Yeah, this, we have the money sitting in the bank, so we can always move at any time. You know, there's still time to put it in the budget, or we can do it later after the budget.
Cause this
when-
is under the certain amount.
Yeah.
That we wouldn't have to have it in the
Right,
budget.
so we can still do this at any time and maybe let PPLE get their piece in first.
Cause
and
I'd like
then-
to hear the sheriff on it too.
And then we meet at the end of September. So we're gonna have end of October. Sorry. If it's the end of September, we need to get an agenda out. It's the end of October.
Okay, we could bump that back.
We can bump that earlier if you
Yeah.
want. But that way we can get it, that way you know what both pieces are you're voting on, I guess. Let me put it that way.
I'd feel more comfortable with that.
So then for clarification, we're approving this to put it in the budget and then it runs through the process before it's actually allocated? Or is this separate from the budget?
I think we should do this separate from the budget. You know, there's gonna be more opportunities coming up. There's still more settlements being made. You know, we just got notification of the Kroger settlement. So, there's still the, Purdue Pharma settlement. That's possible. They're in bankruptcy, but the courts have rejected that that bankruptcy. So there's a whole bunch of more money coming out there and, we want to maybe look at,
Well, HHS is carving out some money as part of supporting this effort, and that seems like that's clearly in their budget. And this would be,
CCS is basically fully funded, so it wouldn't affect that funding stream.
yeah, it's 95% funded. So,
but those two funding streams are gonna work together
Yes.
to make this happen.
Yes.
And so this is or isn't as you see it as part of what's in the budget.
like I said, it's small enough where it doesn't have to be put in the budget. But we certainly can.
Well, I'd like, because I was thinking if we're going through the budget process, we need to allocate that so it's available as you work through the process.
Yeah. The other thing we have to remember is that the opiate funding, I'm sorry, Blake. They're available limited for a limited time. Some of them are 3 years, some are 7 years, some are 15 or 20 years. So, I mean, the pool of money we have is not going to be permanent with that. And that's just, I think we need to look at the whole picture first too.
I think that's the key here is maybe knowing all of what the opioid settlements we have today in the bank, what the drains on those potentially could be, and then deciding which are the most important of those that are, and this would be right up there along with whatever the PPLE and sheriff would ask for. So, but money does us no good on these issues sitting in a bank. It's like all these things, we need to kind of get after it. So I would say we really couldn't approve it today, I don't think, until we have full clarity. But I do think supporting this as a finance committee, we're definitely in support of.
Yeah.
Well, what Blake just said would be a good agenda item for the next finance meeting, a summary of where we're at with the opioid money, the timelines to spend that, and the potential uses that the county is actively looking at, and how that fits into maybe the hope is some relief in some areas of our budget, because there's the opioid money to help us out, because we've incurred those costs because of the opioid crisis, for a decade or more. So now we're, getting some help in many ways, including on the budget going forward.
Yeah.
I did make a motion to support the request. I should further specify that we need to have specifics on that from PPLE and the sheriff before we can allocate funds on that.
So can people who made the motion just withdraw those motions?
Are you asking us to withdraw so that one person can make one motion instead of maybe two people?
I Blake will withdraw my motion because Pat's so much more eloquent.
Well, and I just want to clarify here, because I think this is great, and we talked about it in HHS committee, and we're all in full support of it. And I think I don't, did you mention the grant thing? Because I had a bad day yesterday, so you could have mentioned that in the meeting.
Yeah.
I wouldn't remember.
Yeah, the grant that is on the table is due October 12th.
Because I would think we start moving on that, and then as you guys find the need for it, we could just plug the funds in as needed. It seems to be that piece that will help people more, and then we can continue to find ways of building on that support, whether it's with Bayfield County and the two tribes and such, or a little bigger region.
So let me understand this. The grant that's available out is $1.8 million. Is this for the whole state or is this just for Ashland County?
The 1.8 is for the whole state. There is a carved out amount of at least $443,000 that is set aside for counties with populations of 70,000 or less. So at a minimum, there's 443 available. There may be more depending on how many counties apply for this funding.
Thank you. Back to the motion. You ought to reread that motion, please, or re-edit
Well,
it.
what I'm gonna do is, because Laura would like to go through PPLE, she's chair of that. I'm going to withdraw mine so that she can make a motion, which includes running it through PPLE before it moves further than that. So I'll withdraw my motion.
Do you
And I
recall
just-
your second?
He already did.
Withdraw my second.
Okay, thank you.
I
Here
just,
we go.
can we just say that we're in support of this and then we'll have because at this point, like I said, I don't think we need to go, okay, we'll allocate money for it. I don't, where I'm getting out of this piece is we're in support of it. We start moving on it and then as needed, we'll just put in the pieces that we need. And so I don't think we need a motion at this time because we're not dealing with money. We're just in support of it.
They know we're in support of it.
Is that everybody else's understanding?
Work in progress. Thank you. Let's move on. Donna Sanborn updates, please.
There's not much to say other than, I believe Bayfield we have an agreement with Bayfield County on how to allocate those resources. I did talk to the town and they're happy with the idea. So, Mark and I will be talking this weekend and then we'll talk to WCA and the governor. And I will let Chairman Pufall know as soon as we know everything. That's it. So this is a standing agenda item. I don't know if any of you guys have anything you want to talk about. I still want to support Uniquely Wisconsin. Ms. Negro, I think, has been convinced after meeting with Discover Wisconsin.
I was always in support of this. I just want to see if we can pull in a little more support for it. I did find out that we own, they make us little clips and stuff, so we own all of the footage and everything. We get to point them in the direction that we want. We can use it for commercials, we can use it for Facebook, we can pretty much, we have kind of full control over it, so we could do a great spotlight on our fall and winter activities. I just want to make sure that we don't really have the place to advertise. We don't really have the stuff. That's all from Chamber of Commerce and such. So, and a lot of chambers from what because I did a really good discussion with other people down at WCA, and a lot of them, their chambers are putting in some money too. So I think this is, I'm still squarely where we were before, kind of who else is thrown in, but I'm still in support of it.
Yeah, I don't think Bayfield County is interested in supporting. I'm not sure why, but Mark never gets back to me on the topic. So, I mean, if it comes down to that, I can send Josh Sherman after him, but
I do know that our hotel industry is benefiting, and our sales receipts are going in the right direction. And so as I think about an investment in the future, I kind of look at this as this is an investment in our economic future. And as much as Mary has this kind of puts us in a little bit more of the driver's seat of us marketing ourselves, which I like that idea. We're not reliant 100% on her and expecting her to have to do something that she's clearly not thinking is her role. So I'm in support of this.
So one of the benefactors of this is clearly the chamber, because they get 70% of the hotel tax. And we give the chamber money to draw people to the area. So certainly the chamber would benefit directly in their coffers if more people come and stay in hotels. That whole tourism industry. The thing that we haven't discussed is what would we target in this? If it's primarily tourism, to put, as Mary McFetrick says, heads in beds, well, we're duplicating an effort that we're already paying her for. But if it's something different or in ways different than what the chamber would do for whatever reason, whether or not their mission, job, focus, whatever, That's another story. So are we going to focus, on other things, maybe more towards the economic development end? Maybe we do target, business and industry more, something that builds our long-term economy. Housing is cheap here, but yet for most people that live here, it's not affordable. And it's in relatively poor condition in many cases. So we don't even know what we would target yet, although the assumption seems to be we would target tourists. And if we're doing that, the chamber should clearly contribute. But we should also know what we want to target, and we really haven't talked about that yet.
I noticed or recognized some of the work that Mary's been doing. She has I think it's her stuff. We got a brand new billboard sitting right over here, identifying the amount of businesses we have downtown. I think that's a chamber effort. As a matter of fact, every Sunday morning, there's a real nice clip of Ashland County on the Channel 6. I'm up rather early in the morning, stuff like that. So I see the farm report and this and that, and all of a sudden, oh, I like that. Ashland County clip. It's on a couple of times. I says, wow. Well, so somebody's got to be paying for that. And I'm thinking that's Mary as well. And you got the Bedford Casino, you got Copper Falls, and you got Madeline Island. It's I don't know, maybe a 30-second clip or something like that. But it's professionally put together. It's real nice. And this, what we're discussing right now, would take this to the next step. But much what Pat is saying there is, where do we want to go with this? Do we want to address housing? Do we want to, I'd like to bring some businesses in the area, but we don't have affordable housing.
It's really, the program is really directed towards tourism. It is, yeah, theoretically, it would be businesses too, but we're looking at supporting not just the city and the island, which draw the huge amount of the chamber's work. We're also talking about supporting the southern part of the county. Snowmobiling would be a huge aspect of the programming. I know
Didn't
Price
you
County.
Pull up one of their little clips, because they have a whole YouTube with all their stuff on there. They're all about 5-6 minutes. We don't have to watch the whole thing, but you can see what kind of, because I think that helps see the picture, because we would have to target it. I'm torn. I want to just go, okay, we'll support $40,000 of it if the chamber will throw in 20, and then because still we don't have the expertise, because this is marketing. Marketing is a niche. And yep, we can throw money at this and make this thing, but then what do we do with it? Because 60 grand gets us the material, but it doesn't get us the commercials, the things, the places and such. So it's a good step, but then where do we go from there? So the plan from there is what? Because we own this material, we own all the cuts, we own all these little 5-6 minute commercial things, and they'll do however many we want out of it, but then we own it.
Right.
So then we're holding it.
Right. And
Then
it's,
what?
and it's
Does
not
it
have this
obligate us
podcast,
further?
this podcast that they do.
Yep.
And all that stuff,
Oh, yeah.
stuff stays out there, and people are going out searching these kind of things now for when they want to go on vacation. I don't know. Before I put one on, Pat.
So we have the comprehensive plan committee reforming approved. And, the basic charge of that committee is to take a look at how we want Ashland County to look going forward. Maybe an early charge of that committee would be laying out that broad vision of what we want to look at. So one thing that's been talked about, including, on the Ag and Extension Committee that I'm on, is we think there are more retirees moving here. We think that they have, more money than the average person here. So if we want to, for example, target, people moving here, including the seniors that we think are coming, do we want to target some of that? Because then if they do move here and understand this county, this community, this culture, all that good stuff, this weather, then there's a long-term economic benefit from having them in our region. So, there might be more focus on some of those sort of things, but I think for this committee to say what should it focus on, that's a bit much for us at this point.
Well, also, I think you have to listen to what Discover Wisconsin says. I mean, they are the experts. This is what they do for a living.
Cause my thought is dropping it in Chicago and Milwaukee and the cities, maybe in, Sioux Falls, South Dakota, or just some bigger cities to get people to come here. Because, and you can show what everything looks like, but you have to get them here first before they want to buy property. I mean, I don't see it as a way to get people to move here. I see it as to get people to come here, and then once they've come a few times, then they enjoy the place, they buy a cabin on the lake or
Right.
whatever. But, it gives us a good chance also to show, because I know we'd kind of pitched back and forth just some ideas about, the trails that we've got for snowmobiles and some of the fall activities and, whistle stop and the things, just hitting some of that this fall and showing people, here's these kinds of things. You can come up here and have, going through those trails during the winter. Yep, I'm not exactly the person for the cold weather, but it is idyllic for people who don't have to deal with shoveling 3 feet of snow every day. It's getting those ideas and those people to come here first, because if you never visit, you're never gonna wanna retire here. So it kind of helps with all of it, but laying out a good plan, I think, still involves Mary.
Well, and the other thing it does is too, when you draw more people up here, you're creating more demand for hotel space. And we all know the city's trying to get a hotel over by the Ordoc. You know, I know. But the whole point is though, still, if all of our hotels are filled, that creates the demand for a developer to come in and want to do that. And the more people you get coming here and driving the prices up creates that demand. And to be honest, a hotel would be a nice big piece of tax for us every year.
And the thing is any really good marketing plan also involves our schools, the investments they make in the schools, our businesses, what kinds of plans they have. It's a whole round thing. We can use it to bring in tourism, but in order to get people, if we want people to move here or have second houses, we have to show them the whys, what investments we've made in our communities. And if we don't have where all these other pieces are going, it's not, it's just spitballing again. We might as well be standing with $60,000 up on the top of the courthouse going like this, hoping that these are the right people we're getting it to. So
let me ask a question. This is Mike again. Are we looking to put some money in the budget for 2024? Or, where are we going to go? What's this thing?
Well, I would like to use some of the remaining ARPA funding to do this. So we're not spending levy dollars, I'd like to take some of this remaining ARPA dollars and do this. We consider what you're getting, the multiple programming, the multiple podcasts, all the film that we would have complete control over. It's a heck of a deal. Plus Discover Wisconsin does a bunch of marketing for us. And well, they do it for everybody, for all the
Mike.
programming.
If you're, if you're gonna make an investment like this and you're gonna use money that we're not taking from taxpayers in ARPA, that's a slam dunk because it's an investment in the future. It's marketing ourselves. We keep the content, and it's money that we would lose if we don't spend that the government gave us. So I think those all make a ton of sense for us.
Yeah, and I'm gonna be honest here. I'm afraid as part of any budget deal that gets through Congress this fall, unspent ARPA funds or unallocated ARPA funds are gonna be clawed back. So I would like to allocate this now. Well, as part of the budget, we can do it, but allocate this and get it, make sure Congress doesn't take it back and we get benefit out of it. Nobody's gonna help us unless we help ourselves.
yeah, our state government has already shown that they'll take back that ARPA funding because they deobligated a whole bunch of stuff that was actually already had contracts and things in different departments. They've shorted all their departments by deobligating that and throwing it in the general fund. So I do understand that. Like I said, my comfort level is I'd really like to throw in 40 and hopefully get in 20 from the chamber and then lay out a real good plan and get these other pieces, it maybe if I know the school just had the referendum and they're building on their stuff, but you know, pulling in, MMC, cause it's still, we're right back to last time when we were talking because we don't have the experience and possibly having. Bayfield has their development corporation that does all their stuff, so they have a separate entity that has the experience. So.
Let me ask this question.
I would like to see this implemented a little, boy, you got me too, you turkey. I would really like to see the chamber throw in 20 and us throw in the 40 and then have a really good, like our economic development committee and the new committee have some good input on where we're using this, what places we target, because it's really good to hit the southern part of the state too, or the county and get them some highlights too. So Glidden has their economic development people and, you know, let's bring them all in.
Okay, Pat?
Okay, allocating it, I understand it makes sense. The feds want to claw back and who knows what happens in Madison. So I understand allocating to reduce the chance of clawing back. I would be willing to support it in that sense. But I think this, if we fund this, and something's out there, it has an impact on how Ashland County is shaped in the future. You know, we do the tourism thing because it's quick, easy money, supposedly, you know, they come up and spend money, but then that has an impact on the workforce here. We have so much service sector work, and we know even service sector wages can't support, you know, buying houses, let alone fixing them up for the most part, unless that's their big focus in life. And so, you know, it impacts the quality of life here in that, can the locals afford to have a decent house, fix it up, you know, and go out and have some fun and all that sort of stuff. So if we want more tourism, it impacts the workforce. And we all know the challenges with people buying houses and their incomes here. If 20,000 came from the chamber, so if we did pass something, we could say the county will kick in 40 if the chamber kicks in 20. The chamber can do the bid on drawing the tourists. That's their thing. They're pretty knowledgeable about that. This committee on the economic development, we could look at things that we want to include in that, and maybe in a more implicit, subtle way. And then the planning commission going forward, which is really taking a look at the whole county. So we could talk about, you know, come and visit Ashland County, a great place to live and work. And you talk about, you know, the snowmobile trails, you know, a little bit and that sort of stuff. But we talk about MMC, we talk about Breddings, say Breddings manufacturing, you know, high-end paper manufacturing equipment, you know, lots of great jobs related to machining, et cetera. And it's a great place in your off time to go snowmobiling and stuff. So on the one hand, you're saying you've got these employers, you know, MMC is a big complex. So on the one hand, we're saying we've got these employers who, you know, have jobs and jobs available that we know. And at the same time, if you decide to live here, there's all these other great things about being here versus, you know, wherever you're at now. So you try to plant some seeds, maybe in retirees' heads a little bit, but also maybe some younger people who say, maybe Ashland would be a good place to go, you know, have a career, because that'd be a nice place to live too and to raise a family. So we do our part on selling living here.
I think what you're saying is we market ourselves so we show some fishing, some trolling for lake trout. You show some guys walking, hunting in the woods with their grouse dog and whatever. You do the snowmobiles. You do the ATV in through the country with the beautiful fall colors. We're selling our lifestyle. We're not I don't want to sell Breddings. I don't want to sell Tamarack Health. Like, that sells itself when they come up here. We're not doing that. We're trying to get tourism. That's it. By showing them how beautiful our lives are. The lake, you wake up, you got this gorgeous lake, right? Beautiful. I don't live on it, but I say I do. If you want to show MMC Tamarack Health, that might be a benefit, just to show like, hey, we've got this unique health that is it's here. They own that community, right? So again, but you're overthinking it a little bit here. I think this is a marketing plan. I would say 50,000, 10,000 from them and have them help us, right? From the chamber. But let's not force Mary McFetridge's hand here and say, you got to give us 20. Like, give us something. Help us. Tell us what you'll give us. But let's work together with her on this because she benefits, like you said. But we don't need to get too far down with the employers and all this other stuff. Sell them why am I here? I'm here because I have family here and I grew up here and I love the area. I love the outdoors. That's
If it's in tourism, then Mary should do it.
I make a motion to support this $60,000 with the option of asking for support from Mary.
That I'll second.
Who's gonna make a decision on the content?
It's Discover Wisconsin is going to come up and tell us the kind of stories they think are marketable and will sell. And we will agree on which of their ideas is the best.
Okay, Ron, go ahead.
I'm all for it.
All those in favor say aye. Aye.
I,
All those same sign, motion carried.
can you play a little bit of one of those so he can see?
Pardon?
Just,
Yeah, we're running late. We gotta get Blake back to work. Tundle Point,
Okay, so as you know, we won the case at the DOR. They made a request, it's in the packet. I will say they've appealed the decision to the tax commission. So, there's a closed session on the agenda if you want to negotiate or entertain their offer. Or if you want to make a counter offer or none whatsoever, it's up to you.
go ahead.
The county started giving them money, at a point in time where a particular board member who was chair of finance was very supportive of that. And then during that era, the county finances became very challenging, including asking for a referendum. And we've been trying to right that ship. Bayfield has their own police department. Washburn does. They're in the county seat for Bayfield County. Iron River does. You go down the list. Ashland has to because of our size. It really makes no sense to me why county tax dollars are going to fund a particular police department. But when you look at the history, I know why it's there. And I know last summer you went over there and had a visit with them. And the same person who was the advocate for this in the beginning went along to that meeting. I disagree with that person having been in attendance because it just sends the message that, they're still a strong advocate for this. Just a few notes from Health and Human Services. They're not filling positions right away, is trying to develop some cushion in their budget. We're talking about, contingency money, we should have some and why. Employee raises, to me, 2.5% is below what they should be. I think the raises they got last year were much lower than they should have been. We're looking at higher healthcare costs. And LaPointe, frankly, most of what they do is they patrol to keep tourists in check. They get the economic development, and they have a lot of homes who are vacant for long periods of time. So they patrol to make sure, that those homes are safe. Nowhere else in Ashland County do they get that level of service from our sheriff department. I do understand the sheriff supporting this because it takes some off his plate because his plate is more than full. If we look at parts of the county where we could use more patrol, there are other parts of the county with much more challenging things that happen of a serious nature on a regular basis. And we could put more into our law enforcement department and use it in ways that help more people in very challenging situations. This is not, to me, where that money should go. And I don't think it's in the county's best long-term interest to continue this. And even this Discover Wisconsin, proposal, on the one hand, I'm very supportive of it. But I do know that when your budgets get tight and taxes go up more than people can stomach, it's, you know, somewhere you gotta say no to stuff. Otherwise you end up overspending, which the county had a history of. And this 35,000 we were giving them is part of that history. When Laura and I were on the health insurance subcommittee a few years ago, you know, we talked about, you know, we were, you know, millions over on healthcare because we were undercharging and the county not contributing enough. And the last referendum included in part asking taxpayers, you know, to make up that difference. And the taxpayers in both referendums said no by about 60-40. And I think we can expect the same in the future. So we don't know what our finances will look like going forward. We do know the ARPA money is going to come to an end. We know the economy's run in cycle, and we also know the city of Ashland's been raising property taxes on a regular basis. And when people look at their whole tax bill, you know, they look at the whole thing. And so I don't think we're in a position to raise taxes very much. We've got roads, especially in the southern part of the county, you know, that need repair, things like that. We put a significant amount into County A up there, you know, with rocks and stuff to try to mitigate erosion. So it's a pretty expensive place for us already to maintain. So they get a lot back in other ways. And this is just something where the only reason it started was, you know, really one person. And I think this just needs to come to an end. It's, to me, it's just not appropriate that we're giving that police department money when nowhere else that I could find our counties giving police departments money. It just should have never happened.
I'd like to call on Brian and ask him how things went in 23 this summer. Maybe we can get him online today. Brian?
Hey, I don't know if you can hear me today.
You're muffled. Let me try turning up the volume here. All right, Brian, try again.
Can you hear me?
Yeah.
Okay. Well, so far, the relationship with LaPointe hasn't been very well. We're being called on a regular basis every week. It's pretty intentional. Not because it's, most of the circumstances isn't because it's emergency or life threatening. It's just basically playing the game because they're angry. So we're not responding every time, but we have more than every other year. We've had to go over there because they're covering 5 out of the 7 days. So like I said, the relationship isn't very good. It's more of a game being played by LaPointe. I understand totally what you're saying with the one person trying to orchestrate a deal. I kind of disagree too. I think it should be a group thing more than anything. But at the same point, like I said, how long will this last with LaPointe intentionally calling us every other day for unnecessary reasons? I mean, we're not losing sleep over it. It is what it is, but we're already spread thin, and we'll continue to do what we have to do. So that's all I have to say.
I will say there's the option if you want to discuss anything to go into closed session.
I just have
The-
one
the floor is
comment.
open.
So I was at a different thing and was notified that the head of police of Chief in Mellon has resigned and that they had put on their agenda to possibly disband their entire force. And, you know, as it relates to the sheriff, that could be pretty significant from reliance on sheriff now if the Mellon PD is no longer there. So I was just curious what your thoughts on that are.
Well, I think throughout this past year, we gathered stats on the amount of calls we respond to. Mellon is much higher than LaPointe. But I think that would obviously, it's a pretty high volume for such a small town, and that would increase more if they chose to disband that. I mean, like I said, it's same as what we're doing right now with Mountain Island. If I have two deputies on, I have to send one over there. I call one out. I call the off-duty deputy for overtime. If Mellon chooses to do that, I mean, it would be probably, wouldn't be good. So right now, basically our administration, we're trying to, make sure we're all in uniform and available for patrol and handle calls and assist because, to the point of, like I said, we're spread thin. Right now, we're down 3 deputies. One's in the academy. He won't be done till January, so yeah, it's not gonna be good if they disband.
Thanks, Brian.
And I think Mellon is also part of their consideration is contracting with the sheriff to provide law enforcement. So, which is, again, what the options a town or village has. If they don't want to have their own police department, they can contract with another municipality or county to provide law enforcement. That's what Bad River does.
Okay, that was my question.
Bad River decided they wanted extra law enforcement, so they contracted with the county.
Sheriff, down in the Butternut area, at one time there was a constable, is that correct?
From what I believe, it was before my time here. And you know, I think Glidden also had their own police department as well, from what I've heard.
Yep, so part of what this means is, you know, going down county, that's an hour ride to get all the way down there. They don't have the level of law enforcement that they once did either. So all things being equal, the sheriff's department has more responsibility to take care of things in the southern end of the county than they did a decade or more ago when they had a constable. And I believe Gary Murdoch is on the line, and he, I think, could add a little more background if he would like to.
Yeah, can you hear me? Chairman Berlin, can you hear me? Can you
Yeah,
hear me?
You have the floor.
Okay. Yeah, you know, Glidden as an example, that was years ago. They had a constable. We're talking 40 years ago. In Butternut, it's probably 30 years. And in like town of Agenda, I was a constable, but we're talking probably 20 years ago. I just want to give the finance committee an update on some of the things that have been said about Madeline Island. Yesterday in exec, there was a conversation about Madeline Island paying more taxes. Madeline Island does not pay any more taxes than I do or any of you do for the county. Now, they may, in dollars, an individual household, which is assessed for more money than mine or yours, they could pay more taxes, obviously. But percentage-wise, their county taxes are no different than mine or yours. If their assessed value is higher, obviously they pay more. And the town yesterday, the town came up with $17 million to buy the fleet of transportation vehicles to get across the bay. So I don't know that the town has an argument that this loss of money from the county is costing them anything. And I agree with the sheriff. I believe some of the calls right now are intentional to draw that attention. I think with everything else going on with the county board's budget, it would be best to just leave this as Supervisor Kinney suggested. And the county board's already voted not to give them the money. I don't know why this keeps coming back up. And, you know, we'll let it sit where it is. Thank you.
With that being said, I would look for some action from the board with regards to this request. Yes,
This is Pat. I'll make a motion to deny it, and I agree with what Supervisor Murdoch said. I don't know why this keeps coming up either. It started for a reason that it shouldn't have been. It's not consistent with what goes around in the state. And if calls are being made just as trying to get leverage, I find that highly inappropriate. And I have no interest in caving into that kind of action.
We have a motion on the floor. We have support to the motion.
Ron will second.
Ron seconds the motion. Any discussion? All those in favor say aye.
Aye.
All same sign. Motion carried. Thank you.
Okay, this will not make it to the county board then.
Pardon? That'll go to the county board.
This will not go to the county board
Right.
now. This
Can you
failed the
just
committee.
make sure and provide us an update as to how they respond? Because sometimes it comes back to litigation, right? Isn't that?
Yeah, I assume that's how they're gonna respond, yeah. That's why it's on the agenda. But we have money in the budget for it, so.
Investments, please.
They're in the packet.
Going to critique this or just on our own?
It's just standard. There's nothing wrong with it.
Sales tax report.
The newest one is not available yet, but what I would like to show you is the sales tax forecast. Which is gonna be more important to all of us. Here's the old one, but you saw this at the last meeting. I'll make a note, if you look at that, August number, that reflects actually June, because it's always 2 months behind. So we can expect July and August, I would think, to be, yeah. Exactly. So, I mean, even last year, if you look at the November number, that's actually reflects September.
Is there any transparency on that $56,000 jump over month, or is it just weather and tourism and
It's-
bed?
It's whether it's tourism, it's inflation, it's all the above. You know, the
Time of
numbers come
year.
directly from the Department of Revenue. And anybody can go on the DR's website and get these numbers.
So
But
earlier in the agenda, there was a document from Forward Analytics on estimates for sales tax.
Yeah, I
That
was-
estimate had sales tax in Ashland County being up 3.5% for the entire year. We're already, I think, about 11% over the total for a year ago and on track to be about 20% higher. So I don't understand where Forward Analytics comes up with 3.5% when we've already cleared around 11%.
Well, you know, they're looking at the overall picture. You know, it's impossible for them to know the dynamics of every single county. But, you know, they're looking at how everything is going in the areas. And yeah, we are gonna hit that 1.897 number and beyond. And we're gonna go, I would imagine next year is gonna be high, is gonna be closer to 2 million than 1.9. But you know, I think we can look at these numbers as a good baseline. If we go over, that's great. It's a cushion in our bank account. If it's, you know, so that's one of the ways we can close that gap in the budget is by these sales tax numbers. You know, and I'll go back to the other one, you know, we are clearly seeing a large increase. The only qualms I have is we don't know what the economy is going to do. You know, and that's why I prefer to budget a lower amount to hedge against a bad economy. But
Well, I think when we put our video out, this makes this better, but this also just, again, supports the point that we need to continue to have good plans with what budget we've got now and what capital we need, what things we haven't filled, with just what steps we can take to, and then show people that we can handle a little bit more and still make sure they're getting good services, so.
Go ahead, Pat.
You know, related to sales tax, we've got, it's either Farm and Fleet or Fleet Farm coming in Bayfield County apparently. And they'll certainly, Bayfield County will benefit from the sales tax there. It might put a bit of a ding in ours. But then I guess when I think about, you know, the sales tax here, if we wanted to work on something with economic development, it just seems south of Ashland, south of Northland College there's certainly land available there. And part of the reason for developing that is there's a lot of people that, you know, live in that part of town, not far from there, me included. But it would be a way of keeping more future sales tax here and property taxes here if we could attract some, you know, development there. And, you know, Farm and Fleet, maybe there was a spot big enough for them if they were interested, but, you know, they like the traffic where they're at.
Right.
Um,
Yeah, I mean, getting a housing development down by 13 and Farm Road area would be great because that's ideal spot for housing. It's where you're close to the school, you're close to the hospital, you're on Highway 13 and, you know, you're on the BART line. And drawing more residential development down that direction would certainly spur more commercial development.
There's that really nice lot that, what is it, 20 acres that we own right on Farm Road there that would make really good housing developments inside the city and could be groups of buildings. I know it's not the most favored use for that.
Yeah.
But we hold that, which means that we could make some kind of deal with a developer to put some buildings in there and it would be a nice, just on the edge of town kind of feel.
Right, and the city already I might be wrong in this, but I believe the city already has utilities near there. I also know that there's a large contingent on the county board that does not want to part with that land. You could certainly bring it up, but I'm just warning you.
Well, we're talking about housing, we're talking about economic development, in order to have that rotation that Blake had brought up at the last meeting, you know, to have safe places for our elders and things to go to rotate all the housing stock. Right now, we hold a good piece. We're in control of that, so we could make some good moves with it and make everybody's lives better.
Oh, I'm not disagreeing with you. I'm just saying it's gonna be a contentious issue. That's all I'm saying.
All good ideas. Verbal updates?
So, you got, oh, I'm sorry. So, yeah, no, sorry, you got the budget update, you know, the LaPointe and the Sanborn, which is the majority of things. I will say I stuck this in here under my updates because I literally just got it yesterday. And so the new health insurance, the new dashboard for the health plan, I literally got this yesterday afternoon. So I didn't have a place on the agenda to put it other than here. So, as you can see, we're running just a slight bit over. Whether that trend continues, I don't know. It's been going up and down, as you can see by the graph. But it's still better than last year, which was like 110% over. So, which all the more reason validates the 10% increase in insurance.
Could you remind us, we had a bit of a cushion built in case, you know, we went over, we're within that cushion yet, correct?
Yeah,
Easily.
yeah.
Yeah.
So like I said, this is on the website. I just got it yesterday, so you can look at it more closely later. I want to be honest, things like this and the sales tax reports, we're dependent upon other organizations to get us the data, so you might not get the most up-to-date one in your packet, or you might just get it in like today. It's like, I got this yesterday, so I'm giving it to you now. So.
Next meeting date.
Okay, next meeting date, yeah, sorry. So, you know, we're gonna. Let me get to. You know what, it's just easier to do it this way. Okay, so. I'd like to move the meeting to October 7th. We're gonna have a county board on the 10th to go over what I think.
Dan?
Yeah.
Dan?
Yeah.
The 9th. Yesterday you changed the county board to Monday, the 9th.
I thought we said, oh, maybe you're correct. We did because somebody couldn't be there.
Yeah, Supervisor, Bill.
Bill Metzinger requested the 9th. So, county board will be the 9th. Thank you, Mr. Supervisor Martic. Will be the Monday the 9th. It'll be budget preview for the county board. And then we can't hold a meeting on the 16th. There was something going on the 16th where we couldn't do finance. That's it. Chairman's in DC. So the 17th, can we do it then? Because I will be in Madison on the 18th. And so I'll just leave for Madison after this meeting. No, the county board's going to be on the 9th at 9 a.m. County board on the 9th at 9 a.m. Finance committee on the 17th. And executive committee on the 31st. And if we need to hold another finance committee meeting before November 7th, the county board, we could pencil in November 1st. Yeah. So can we just tentatively plan on November 1st if we need it for finance? And then just again, November 7th is the day we pass the budget and levy and that's to cover any changes that we would have to make between publication and the budget. And Tom is going to make sure he reserves a spot in the paper on the 20th. Oh, okay. You're not gonna be here? Oh. Okay, shit. Sorry. I know. All right. So does the 19th work? For finance, does the 19th work? No, Chairman Berlin is out on the
Oh, you're
16th.
not gonna be back from Madison.
Oh, that's right. I'm not gonna be back from Madison.
How about you have Chair Berlin miss that meeting?
Yeah.
Excuse, if that's okay with you.
Fine.
Okay, so do you want to do Monday or Tuesday then? All right, Tuesday, we'll stick with the 17th. Okay. Okay, I'm sorry.
So, yeah.
I'll make a motion to adjourn.
All those in favor?
Yeah.
I.